If you have not had a complete bowel movement in the last 48 hours, what I am about to tell you should genuinely concern you. Right now, at this moment, decomposing waste is sitting in your lower intestine, producing inflammatory compounds that are leaking through your gut wall and entering your bloodstream. The longer it sits there, the more your intestinal barrier weakens. The more your barrier weakens, the more toxins cross into systemic circulation. And the more toxins circulate, the higher your baseline inflammation climbs. Chronic constipation is not discomfort. It is not an inconvenience. It is your gut slowly poisoning the rest of your body while you wait for something to happen on its own. And it will not happen on its own. Not without the one specific input your colon has been missing. I have been practicing internal medicine for 15 years. I have watched patients ignore constipation for years, treating it as a minor annoyance, while their inflammatory markers crept up. Their energy disappeared, their skin deteriorated, and their bellies expanded with a distension that no diet and no exercise could touch. Because it was never fat. It was a backed up, inflamed, leaking gut that nobody addressed. What I am going to show you is a specific substance that you add to a glass of water once a day. It does three things simultaneously. It ends constipation, not by forcing your bowel to contract the way a stimulant laxative does, but by restoring the natural mechanics of how stool moves through your system. It heals the gut lining by feeding the exact bacterial species responsible for producing the compound your intestinal wall needs to repair itself. And it flattens the belly by eliminating the chronic distension that comes from a backed up, inflamed digestive tract. This is not a supplement trend. This is not a wellness hack. This is a fiber that has been studied in randomized controlled trials, published in journals including gastroenterology, and described by researchers as the gold standard for regulating bowel function. Subscribe to Dr. Kevin Miles and hit like. There is a lot more coming and you do not want to miss it. Let me start by explaining what is actually happening inside you when you are constipated, because once you understand the mechanics, the solution becomes obvious. Your colon has one primary job. Take the liquid slurry that arrives from your small intestine, extract the remaining water and electrolytes, compact the residue into a formed stool, and move it toward the exit. The movement part is called peristalsis. Rhythmic muscular contractions that push the contents forward in a wave pattern, like squeezing a tube of toothpaste from the bottom. For this process to work, two things need to be true. The stool needs to be the right consistency, soft enough to move, but solid enough to hold its shape. And the colon wall needs to be receiving the correct signals from the nervous system and the local bacterial environment to contract at the right frequency and strength. When you are constipated, one or both of those conditions has failed. In most people, the first failure is mechanical. The stool is too dry. It has lost too much water during its transit through the colon, and now it sits there like a dense plug that the muscular walls cannot push forward efficiently. You strain, you push, nothing happens. Or a small, hard fragment breaks off, and you feel like you have not finished. The second failure is biological. The bacterial ecosystem inside your colon, the community of trillions of organisms responsible for producing the chemical signals that regulate gut motility, has shifted into a state where the motility signals are weak or absent. The colon wall is not contracting with the rhythm it should. Transit time slows. Water extraction continues even though the stool is already too dry. The problem compounds itself. Most laxatives address the first failure by brute force. Stimulant laxatives trigger aggressive contractions. Osmotic laxatives pull water into the colon artificially. They work in the short term, but they do not address the underlying problem. They do not restore the bacterial environment. They do not repair the gut wall. And in many cases, the colon begins to depend on them. You end up in a cycle where you cannot go without a pill, and the pill works a little less every time. What I recommend to patients, and what the clinical research increasingly supports, is a completely different approach. Not forcing the colon to work, giving it what it needs so that it works on its own. The ingredient is psyllium husk. Now I know what some of you just thought. Fiber. That is what he is going to tell me. I already tried fiber. It did not work. Stay with me. Because the reason it did not work is almost certainly not because psyllium does not work. It is because you took it wrong. The dose was wrong, the timing was wrong, or you did not drink enough water with it. And those details are the difference between nothing happening and your gut resetting itself within a week. Let me explain what psyllium actually does, because it is not what most people think. Psyllium husk is the outer coating of the seed of a plant called Plantago ovata. When it contacts water, it does something remarkable. It absorbs 8 to 14 times its own weight in liquid and forms a viscous gel. Not a paste, not a sludge, a smooth, slippery gel that moves through your digestive tract with almost no friction. This gel does three things simultaneously, and each one addresses a different layer of the constipation problem. The first mechanism is mechanical. The gel adds bulk to the stool and holds water inside it. This is the critical detail. Psyllium does not just absorb water. It retains that water all the way through the colon. The stool stays soft and hydrated. It does not dry out and compact into a plug. It maintains the ideal consistency for the colon wall to grip it and move it forward efficiently. You do not strain. You do not push. The stool moves because the mechanics are correct. Clinical studies comparing psyllium to standard pharmaceutical laxatives have shown that psyllium is as effective or more effective at relieving constipation, with significantly fewer side effects. One review published in a leading gastroenterology journal describes psyllium as deserving the name gold standard in regulating bowel movements, outperforming both sodium docusate for constipation and loperamide for diarrhea. That last point is important. Psyllium does not just make you go, it regulates. If the stool is too dry, the gel adds water. If the stool is too loose, the gel absorbs the excess. It normalizes in both directions, which is why it works for both constipation and diarrhea. No pharmaceutical laxative does that. The second mechanism is where it gets genuinely interesting. Psyllium is a prebiotic. A prebiotic is a substance that your body cannot digest, but that your gut bacteria can. It is food for them. And psyllium contains a specific type of fiber called arabinoxylan that preferentially feeds the bacterial species you want to grow. When your gut bacteria ferment arabinoxylan, they produce short-chain fatty acids. The most important of these is butyrate. And butyrate is not a minor metabolic byproduct. It is the primary energy source for the cells that line your colon, the colonocytes. Let me say that again because it is that important. The cells that make up the wall of your colon do not primarily run on glucose the way most of your cells do. They run on butyrate. When butyrate levels are adequate, those cells are healthy, the gut wall is tight and intact, and the barrier between the inside of your intestine and your bloodstream is sealed. When butyrate levels are low, those cells are underfed, the gut wall weakens, gaps appear between cells, and inflammatory molecules from the intestine leak into the bloodstream. This is the condition researchers call increased intestinal permeability. You may have heard the colloquial term leaky gut. The clinical reality is straightforward. When the gut barrier is compromised, systemic inflammation rises. And systemic inflammation is the root driver of a staggering number of conditions, from bloating and food sensitivities to skin problems, joint pain, brain fog, and metabolic dysfunction. Psyllium, through its prebiotic effect, feeds the bacteria that produce the compound your gut wall needs to stay intact and functional. Research has shown that psyllium supplementation increases the abundance of 3 bacterial genera specifically known for butyrate production: Lachnospira, Roseburia, and Faecalibacterium. These are not obscure laboratory organisms. Faecalibacterium prausnitzii is one of the single most important markers of gut health. Its depletion is consistently associated with inflammatory bowel disease, IBS, and chronic digestive dysfunction. Published research in gastroenterology has confirmed that psyllium decreases gut inflammation, reduces C-reactive protein levels, improves intestinal barrier function, and downregulates circulating inflammatory markers, including interleukin-1 and interleukin-6. You are not just relieving constipation, you are rebuilding the biological infrastructure of your gut. The third mechanism is the one that affects how your belly looks and feels. And this is the piece that most people do not connect. Chronic constipation means stool sitting in your colon for extended periods. That stool mass occupies space. It creates visible distension. Your belly pushes outward not because of fat, but because there is a physical backlog inside your intestines. But the distension is not just about the stool itself. A backed up, inflamed colon produces gas. The bacterial imbalance that accompanies constipation favors gas-producing organisms. The slow transit time gives those organisms more time to ferment residual carbohydrates. The gas builds. The belly swells further. When you introduce psyllium and the gut begins moving correctly, 2 things happen. The physical backlog clears, and the bacterial environment shifts toward species that produce less gas and more butyrate. The slow fermenting nature of psyllium itself means it produces significantly less gas than other fermentable fibers like inulin or chicory root. This is why many people who say fiber makes me bloated have actually been taking the wrong type of fiber. Psyllium produces the benefits of fermentation without the gas penalty. Within 3 to 7 days of consistent use at the correct dose with adequate water, most patients report measurably flatter abdomens, not because they lost fat, but because the bloating and distension from a dysfunctional gut has resolved. Now the protocol. And I'm going to be very specific because the details determine whether this works for you or whether you give up after 3 days and conclude it does not work. Step 1. The dose. Start with 1 teaspoon, approximately 5 grams once per day. This is a starting dose, not a therapeutic dose. Your gut needs time to adjust to the increased fiber load. If you start at a full dose, you may experience temporary bloating and gas as your microbiome adapts. That adaptation period is normal and it passes, but starting low minimizes it. After 3 to 4 days, increase to 2 teaspoons. After 1 week, if you are tolerating it well, move to 1 tablespoon, approximately 10 to 12 grams. This is the range used in most clinical studies showing significant benefit. Step 2. The water. This is the single most common reason people fail with psyllium. They stir a teaspoon into half a glass of water and drink a thick paste. The experience is unpleasant, and the results are poor. Psyllium absorbs massive amounts of water. If you do not provide enough, it will pull water from your intestines, making your constipation worse, not better. That is the opposite of what you want. The clinical recommendation is 500 milliliters of water, approximately 16 ounces, for every 10 grams of psyllium, a full tall glass. Mix the psyllium in, stir it vigorously for 10 seconds, and drink it immediately before it thickens. Then follow it with another glass of plain water over the next 30 minutes. If you find the texture difficult, here's a practical tip. Mix the psyllium into cold water, not warm. Cold water slows the gel formation and gives you time to drink it while the consistency is still thin. You can also add a squeeze of lemon. It does not interfere with the mechanism and it makes the experience considerably more pleasant. Step 3. The timing. Take it 15 to 30 minutes before your largest meal of the day. Here is why. The gel that forms in your stomach creates a sensation of fullness. It slows gastric emptying. Research has shown that 6.8 grams of psyllium taken before a meal produces a statistically significant decrease in hunger and desire to eat, with a corresponding increase in fullness compared to placebo. You eat less without trying. You eat less because your body is genuinely satisfied sooner. This is not a weight loss drug. But the satiety effect, combined with the resolution of bloating, means that most people notice a visible difference in their abdominal profile within the first week. If your primary concern is constipation rather than satiety, you can take it first thing in the morning on an empty stomach with a large glass of water. For some patients, the morning dose on an empty stomach produces the most reliable bowel movement later that day. Step 4. Consistency. The microbiome changes, the butyrate production, the gut barrier repair. These are not overnight effects. They accumulate over days and weeks. Research on psyllium and microbiome composition has shown meaningful shifts in bacterial populations within 1 to 2 weeks, but the full range of benefits, including reduced inflammatory markers, requires 4 to 8 weeks of consistent daily use. Do not take it for 3 days, feel slightly better, forget about it for a week, and then start again. The bacterial species you are trying to cultivate need consistent substrate. They need daily feeding to establish a stable population. Consistency at 1 teaspoon is worth more than sporadic use at a tablespoon. Step 5. What not to combine it with. If you take medications, separate your psyllium from your pills by at least 1 to 2 hours. The gel that psyllium forms can slow or reduce the absorption of certain drugs if they are present in the gut at the same time. This is especially important if you take thyroid medication, blood thinners, or any drug with a narrow therapeutic window. Take your medication first. Wait 2 hours. Then take your psyllium. Now, here's what to expect week by week, because managing expectations is what determines whether people follow through. Days 1 through 3. If you started at the correct dose with adequate water, you will likely notice that your stool softens. It may not come more frequently yet, but the consistency changes. The hard, dry fragments become smoother and easier to pass. Some people notice mild bloating as the microbiome adjusts. This is temporary and resolves. Days 4 through 7. Bowel movements become more regular. Many patients report their first complete, satisfying bowel movement in weeks. The belly begins to feel less distended. The morning puffiness that you attributed to water retention or food intolerance starts to diminish. You may notice you are less hungry between meals. Weeks 2 through 4. This is where the deeper changes begin. The microbiome is shifting. Butyrate-producing bacteria are expanding. The gut wall is receiving consistent fuel for repair. Inflammatory markers begin to drop. People describe this phase as feeling lighter. Not lighter on the scale necessarily, but lighter internally. Less pressure, less discomfort. Less of the background noise of a dysfunctional gut that you had gotten so used to you forgot it was there. Weeks 4 through 8. If you have been consistent, this is where the full picture emerges. Bowel movements are predictable. The belly is measurably flatter. Food sensitivities that you attributed to specific ingredients begin to resolve because the gut barrier is intact and inflammatory signaling has decreased. Energy improves because your body is no longer diverting resources to managing chronic, low-grade intestinal inflammation. Sleep may improve because the gut-brain axis is no longer sending distress signals at night. A few important clinical notes before we close. If you have active bowel obstruction, difficulty swallowing, or any condition where your doctor has told you to avoid bulking agents, do not take psyllium without medical clearance. If you have diabetes and take insulin or oral hypoglycemics, monitor your blood sugar closely when starting psyllium. It improves insulin sensitivity and slows glucose absorption, which is generally a positive effect, but it may require medication adjustment. If you are pregnant or nursing, psyllium is generally considered safe, but speak with your physician first. For everyone else, psyllium husk is one of the safest, most studied, and most affordable interventions in all of digestive medicine. A bag costs less than $10 and lasts 2 months. Let me bring it all together. Chronic constipation in the majority of cases is not a disease. It is a mechanical and biological failure caused by insufficient soluble fiber, inadequate stool hydration, and a depleted gut microbiome that is no longer producing the butyrate your colon wall needs to function. Psyllium husk addresses all three simultaneously. It forms a water-retaining gel that creates the ideal stool consistency for pain-free, complete evacuation. It acts as a prebiotic that feeds butyrate-producing bacteria, rebuilding the gut barrier and reducing systemic inflammation. And it resolves the bloating and distension caused by a backed-up, gas-producing, inflamed colon. The protocol is 1 teaspoon in a full glass of water for the first few days, building to 1 tablespoon over a week, taken 15 to 30 minutes before a meal or first thing in the morning, followed by adequate water, every single day. The clinical research calls it the gold standard in bowel regulation. It outperforms standard pharmaceutical laxatives. It costs less than 50 cents a day, and it has been sitting in the supplement aisle of your grocery store, ignored, while you spent 10 times as much on products that address symptoms without touching the cause. How old are you? Leave your age in the comments. The reason I ask is that gut transit time naturally slows with age. Butyrate-producing bacterial populations decline after 50. The colon wall becomes less responsive. What was occasional constipation at 35 becomes a daily struggle at 60. The urgency of getting this right increases with every decade, and I want to make sure I am building content that meets you where you are. Your gut is not broken. It is not defective. It is waiting for one specific input that it has not been receiving. Give it that input, give it adequate water, give it 7 days, and watch what happens. I am Kevin Miles. Most doctors won't tell you this in a 15-minute visit. I will. Subscribe to Dr. Kevin Miles and hit like. There is a lot more coming.